Hi, I'm Moira Wong. I'm the orthodontist at the clinic, and this is.
Carmen Colomar.
And Carmen and I work as a team. Carmen we both look after children as a team. I'm the orthodontist responsible for looking at children's development, teeth development, and jaw growth. And Carmen does the dentistry.
Yes, I do the dentistry for all the children that we have at the practice, and yeah, we enjoy a lot of working together.
Yeah. So sometimes, Carmen, I see patients when they first come to me to look at orthodontics, and they are, say, round about age 8 or 7, 9 age. And sometimes, unfortunately, maybe because of the pandemic or for various reasons, these children haven't managed to have a checkup for some time. And I'll suddenly see that there's a little cavity in a tooth, and I'll refer to you. Now, some of these children actually suffer pain with these cavities, and I was just wondering what kind of treatments are there available for children that have holes in their baby teeth?
Yes, so when the decay is that extent that has affected the pulp, there are options available of treatment to preserve the tooth and avoid extraction. So depending how affected the pulp is, we could do pulpotomy or pulpectomy.
And what actually, I mean, lots of people talk about these different terminologies, but what is the difference between say, a pulpectomy and a root canal?
So pulpectomy and root canal, they mean the same, the root canal treatment, but dentists tend to use the root canal term for permanent teeth, and the term pulpectomy to refer to baby teeth. But in terms of meaning, it's the same. It's just to remove the whole pulp of a tooth.
Okay.
A root canal treatment is basically a pulpectomy. So it's just we use
so it's a root canal treatment in a baby tooth.
Exactly.
And from an orthodontic perspective, I'm very keen for children to keep their baby teeth because one of the functions of baby teeth is actually to hold the space for the adult tooth that's often underneath, waiting to rub. So if the baby tooth comes out, often the teeth either side will close, the space will close, and then that adult tooth will become impacted. So I'm very grateful for the work that you do in terms of pulpotomies and pulpectomies for these children. And the other term that I've heard um, named or is a pulpotomy. So what's the difference between a pulpotomy and a pulpectomy? When do you do one and when do you do the other?
So when the pulp is affected either by traumatic injury or by decay, depending how much the pulp has been affected, we do pulpotomy will be in cases that there's a bit of pulp exposure with reversible inflammation. We can remove with the pulpotomy the pulp partially, so we would remove like just the part of the pulp of the nerve and the vessels of the tooth inside the crown of the tooth. In the pulpectomy, would do in more like irreversible damage or infection cases, we will also remove the pulp from inside the canals of the tooth.
So the pulpectomy is a slightly more extensive procedure. Yes. Where you remove the whole of the inside
it's
tissue.
It's a complete removal of the...
Okay. And the pulpotomy is where maybe the damage to the tooth is not so much and you can just take a section.
Exactly.
And so the tooth stays alive. And I guess, I mean, what do you find in terms of the success rate of these types of treatment in trying to save these baby teeth so that the adult teeth will have space?
Yes, so if the pulpectomy is done correctly, it will last until the tooth exfoliates.
Oh, right, so they're pretty predictable.
Yes,
treatments.
But
really.
Sometimes it's like everything in medicine. You can't control bacteria, your removal, you do your best. Sometimes treatments are supposed to last, but sometimes you have this little bit of percentage of failure.
Okay, but as a general rule, it's quite a successful, predictable. Apart from maybe in the special cases to save the baby.
Yeah, you always have limitations when there's that resorption that you can't just let the patient know. Like you will always in time to take the tooth out because some cases with a resorption and they can carry on with internal or external resorption and the pulpectomy may not be successful. But in the worst case, you can always remove the tooth. We look for other options like putting a space maintainer, but you try to give one more chance to the tooth.
Yeah.
As long as the patient is aware of the long-term outcome on the specific case, is a good option.
So at the end of the day, I have this child, they have a big hole in their tooth. The first point of assessment would be to determine whether the tooth could just be filled, or if the patient's in pain, we determine whether it needs just a pulpotomy.
Yeah.
If it's more extensive, the damage to the tooth, then we're looking at pulpectomy. And I suppose even if it buys to get us close to the adult tooth ready to come through, that's always going to help us. And if the worst case scenario, if we have to take out the baby tooth, then we have measures where we can put something in the mouth to hold the space so they don't have impacted adult teeth later on. Well, thank you very much for clarifying the differences between those different procedures. Thank you.
Thank you for your time.
Thank you.